Hello, my name is Brandy Terzin. This is my video assessment for remote collaboration, evidence-based care, and nursing FlexPath 4030 for Capella University. For this assessment, I will be exploring evidence-based care solutions for the Vila Health scenario involving Caitlin, a 2-year-old girl admitted recently to Valley City Hospital. She was admitted with pneumonia and malnutrition and a new diagnosis of cystic fibrosis. Cystic fibrosis is a complex diagnosis, and Caitlin's situation is further complicated by her living over an hour away from Valley Health and in a very small town of less than 100 people. There may be limited resources for her care and the education for her parents, who are her primary caregivers. There's also the psychosocial situation of her parents being separated and both working long hours outside of the home. The proposed care plan is designed at addressing the family dynamics associated with her care and concerns related to her care and monitoring in a remote setting. An interdisciplinary team has met to discuss discharge planning and a plan of care for Caitlin as she returns home. This team includes Dr. Copeland, the pediatrician at Valley City Health, Virginia Anderson, the nurse responsible for care during her recent admission to the hospital at Valley City, and Dr. Benjamin, who is her pediatrician in McHenry, where she resides. Also included are Madeline Becker, her social worker in McHenry, Marta Simmons, her social worker at Valley City Hospital. According to Cesniak et al., cystic fibrosis is a chronic, life-limiting genetic disease affecting the lungs. The study goes on to state that, quote, a hallmark of CF or cystic fibrosis is the burdensome daily home care management regimen, end quote. This treatment consists of pancreatic enzymes, chest PT, an increase in caloric intake, bronchodilators, and surfactants to prevent pneumonia. Also included in this regimen is fat-soluble vitamins. Part of her care plan would be to educate Caitlin's parents on her treatment regimen at home, and also teaching them the early signs and symptoms of lung infection or respiratory distress to indicate that she needs further monitoring or a hospitalization as they live 1 hour away. Also, as she has a history of a bowel obstruction, teaching on signs and symptoms to recognize any indicators of a bowel obstruction would also be helpful to her parents. It's also important for the interdisciplinary team to assess for the level of understanding and acceptance of Caitlin's parents of her diagnosis, and also the understanding related to her treatment regimen at home, as it is very complex and detailed and time consuming on a daily basis. Also, the emotional support that they could potentially need related to this diagnosis, and the financial burden, as it is difficult for parents of children with a chronic disease. Proper communication and remote monitoring with Caitlin's parents will be crucial to her at-home care, and this thus preventing a delay in care and subsequent need for future hospitalizations. Edwards et al. 2018 states that teaching from the interdisciplinary team at the medical center happens initially at the time of diagnosis, but also notes that if parents are from a remote or rural location, education may need to occur on an outreach basis. Results from a survey by Edwards et al. From 2018 found that parents preferred face-to-face communication from the medical center or Skype or phone conversation, but often parents in the rural setting resorted to online sources of information related to treatment regimen, leading to the need for further education by the interdisciplinary team of how to search for relevant, reputable, and reliable sources. Referral by social workers to local or regional support groups specific to cystic fibrosis, if not available in her area, online support groups or blogs specific for parents of children diagnosed with cystic fibrosis. There is also technology available via applications used to monitor patients with cystic fibrosis at home. Monitoring lung function is vital to the health of cystic fibrosis patients. This typically occurs in the doctor's office or ERs, but in remote location, as Caitlin and her parents reside, they may have limited or no access to this type of monitoring. According to Sun et al. 2017, most patients and caregivers do have access to smartphones. As presented by Sun et al. 2017, there is a low-cost point-of-care smartphone-based medical tool for the at-home monitoring of cystic fibrosis exacerbations. Sun et al. Describes this as a device that consists of a smartphone-based pH sensor that has a sputum collection sample holder, which is reusable and plugs into the headphone port of the smartphone to make and track measurements via a custom app. This device is unique from previous point-of-care devices as it allows for daily pH monitoring of patients' sputum, thus potentially detecting exacerbations, allowing for adjustments in at-home care, and preventing hospitalization based on this daily monitoring. It could be a useful tool for Caitlin's parents given their location and the fact that they may have limited financial resources for travel and hospitalizations and work restraints. The consideration of an additional task of daily care to Caitlin in her treatment with the use of this device must be made. As stated before, the day-to-day care of a child with cystic fibrosis can be time-consuming and complex, so an additional task may be an overwhelming concept to her parents. This care plan was developed using the Iowa model for evidence-based care. According to Buckwalter et al. 2017, the Iowa model is a widely used framework for implementing evidence-based practice. It is a process including multiple steps based on Rogers' theory and uses enhanced interprofessional collaboration, and widespread use of electronic data. Also, the emergence of implementation science, pay for performance, and enhanced patient engagement. The Iowa model focuses on patient engagement, which would be Caitlin's parents in this situation, as they are her caregivers, being that she is a 2-year-old pediatric patient and unable to be responsible for her care and monitoring. A team approach to quality care for which Caitlin has been provided in the Vila Health scenario by her interdisciplinary team. In conclusion, the care of patients with cystic fibrosis are highly individualized, and recognizing the importance of education and use of telemedicine resources available to Caitlin's parents during her time of initial diagnosis and subsequent care at home has been provided in this proposed care plan. The interdisciplinary team has provided many resources to facilitate Caitlin's care at home by her parents, given the remote location in which she resides. The care plan has also provided resources to prevent barriers which may arise as her daily care continues. Thank you.